Hey, it's Dr. Goodwin, your vet cardiology concierge, back again to talk to you more about feline heart muscle diseases. There are a lot of them, as we talked about in a previous video that you probably could see right there, one of those two spots. With cats, they tend, when they have heart disease, to get more heart muscle diseases. And there's a few of them that we can talk about that are pretty more commonly seen. One is where the heart muscle itself starts to thicken more than it should. Every heart has two jobs. It has to pump blood out, but before it can pump more blood out, it has to fill. So what happens with some of these kitties, when they have a heart muscle that's getting thicker than it should, that chamber that we're using to fill starts to thicken. It would be equivalent to a cup that stays the same height, but as the walls thicken, it becomes like a thermos. A thermos cannot hold as much fluid in it as a regular cup. And so when we get wall thickening, that wall thickening can make it so not as much blood can come into the heart. If not as much blood can come in, one, you can't pump as much blood out. Number two, you can create a backup in blood flow. That disease where we see the heart muscle thicken for no other reason other than genetics is called hypertrophic cardiomyopathy, or HCM. The hyper just means increased. Trophic stands for growth. And of course, cardio is heart. Anytime you hear myo, that's muscle. And pathy just means disease. So increased growth of the heart muscle disease. This HCM, or hypertrophic cardiomyopathy, is one of the more common cat heart diseases that can result in an inability of the heart to get as much blood in and pump as much blood out, which can result in a lot of problems for them, and potentially, when severe enough, can be life-threatening. Another type of cat heart muscle disease that they can get is they can get changes in their heart muscle that cause that muscle to get stiff. As that muscle's stiff, it may not be thick, but if it's stiff enough, it doesn't stretch to expand to receive more blood. That restriction in filling is called restrictive cardiomyopathy. With these cats, we don't often see a thick heart, but we'll see a heart that does not relax well. It pumps fine, but doesn't relax well enough to allow a lot of blood back into the heart so blood can be pumped further out to the body. We often will see fluid back up in these patients, and you'll get chambers of the heart that start to enlarge because of that backup. Another one that we see often in kitties is when your thyroid is actually having an effect on the cat's heart muscle. Some cats, when they become hyperthyroid in their later ages, typically over the age of 10, you can get situations where this hyperthyroidism, or this increased production of the thyroid hormone, causes the heart to start to overwork and start to become hypersensitive to the thyroid hormone. This overworking can send the heart into a situation where it's working so hard, it's also not resting well, and it's preventing nice flow through the heart. So again, those are just a few, but we have a lot more cat heart diseases that we'll be able to discuss as time goes on. If you want more content like this, please hit the like or subscribe button, and we'll talk to you soon.